Welcome to Change class number 8, Preparing for Surgery. Objectives today are to review the next steps after the Change classes are completed, review requirements for surgery to be scheduled, discuss potential complications of surgery, discuss needed medications and vitamins after surgery, and to discuss follow-up visits. Preparing for surgery. Once all pre-op appointments have been completed, surgery will be scheduled. These include a pre-op anesthesia visit, pre-op visit with your surgeon, and any lab work needed. Make sure you have submitted your food records or any other requirements needed for insurance purposes. FMLA paperwork can be submitted through the patient portal or faxed to nurse practitioner Tanya Benjamin. Any medications you are taking that you will need to stop or adjust before surgery will be discussed at your pre-op anesthesia appointment. You should bring to the hospital an updated medication list, contact information, and a CPAP or BiPAP if you're using. Let's discuss possible complications of the surgery. Any discussion of surgery should include risk, benefits, and possible complications. It is important to understand that some of these complications are possible with any type of surgery and not just bariatric surgery. If we approach surgery correctly, we can help decrease risk and avoid complications. Pneumonia and blood clots can be a possible complication of any surgery. If you are overweight and obese, you are at a higher risk for these complications. Patient positioning, medications, and pain can lead to ineffective breathing and allow fluid collections in the lungs. To help avoid this, when you wake up from surgery, you will have a device on your bedside table called an incentive spirometer. This device is used to help your lungs recover from surgery. You place a tube in your mouth and breathe in deeply. The device gives you a visual idea of how deeply you are breathing. You are encouraged to use this device about 10 times an hour until you are walking and consistently able to take deep breaths. To help avoid blood clots, you will have something called a sequential compression device placed on your lower legs during surgery. It is a wrap around each leg that is connected to a pump that inflates and deflates to assist circulation in your legs. Once you are up and walking around consistently, these will be removed. Infection. Patients are often focused on their surgical incision and looking for signs of infection. However, other infections can occur, such as pneumonia or urinary tract infections. If you have any concerning symptoms of infection, you should contact the number on your discharge instructions for further discussion. The number on your discharge instructions is a 24-hour, 7-day-a-week number that you can call for assistance. Leaks are an uncommon but an early complication that can happen up to a month after surgery. Symptoms may include rapid heart rate, fever, stomach pain, drainage from a surgical wound, nausea and vomiting, pain in the left shoulder area, low blood pressure, and decreased urine output. You are checked for leaks during surgery and before you leave the hospital. If you have any concerning symptoms, please contact the number on your discharge instructions. Ulcer. You are at higher risk for an ulcer if you had ulcers in the past. One of the best ways to avoid ulcers is to avoid the things that contribute to ulcers, such as smoking and NSAIDs. NSAIDs are non-steroidal anti-inflammatory medications and include medications such as Aleve, Advil, Celebrex, and Motrin. NSAIDs can damage the lining of the stomach, leading to gastritis or inflammation inside the stomach or an ulcer. Tylenol, on the other hand, is not an NSAID and can be used unless you have liver disease. Smoking can affect the lining of the stomach by reducing the amount of oxygen that gets to the tissues, causing damage. It can also impair wound healing. Stricture. This could be an early or late complication that may cause a blockage. Symptoms may include nausea and the inability to pass food or fluids down your throat. This can be corrected using endoscopic or surgical procedures. Nutrient deficiencies. A lifelong supplement regimen is recommended to avoid nutrition deficiencies after bariatric surgery. You will be taking a multivitamin with iron, additional calcium, and vitamin D and B12 supplementation. You will be screened for nutrition deficiencies in your follow-up visits. Gas and constipation. These can be part of any type of surgery, but particularly abdominal surgeries. Abdominal surgeries can interrupt the normal squeezing motion of the bowel. You will need to be able to pass gas or have a bowel movement prior to being discharged from the hospital. Narcotic pain medications can also be very constipating. You will likely be sent home with a stool softener, which is encouraged to take as long as you are on the narcotic pain medication. Once you are up and moving around and able to stop the pain medication, you can stop the stool softener. Other possible complications may include taste changes, food intolerances, fatigue, thermoregulation, pain, dehydration, nausea, and hernia. Dumping syndrome is something that can develop after surgery, also called rapid gastric emptying. Food, especially sugar, moves from your stomach into the small bowel. Symptoms occur right after eating, and you can feel bloated or full, nausea, vomiting, abdominal cramps, diarrhea, flushing, or dizziness. You can avoid dumping syndrome by eating smaller meals and more protein, drinking fluids between meals rather than with them, avoiding alcohol and high sugar foods such as candy, table sugar, and syrup, and increasing your fiber intake. After surgery, please have the nutrition guideline booklet that you see here to the right that you were provided ready for use after surgery. Any questions, please contact the dietitian by phone or patient portal. Discharge instructions will be provided at discharge from the hospital. Please review the medications and the contact information. Pain. Patients often ask if bariatric surgery is painful. Some patients feel the pain was minimal. Others feel the pain was more than what they expected. Your experience with pain is individual. When you wake up from surgery, you will be connected to a PCA pump, a patient-controlled analgesia, and will have a button that you can press when you feel pain. The pump will immediately deliver IV pain medication to you. If you are still in pain after pushing the button, you will need to contact the nurse for further pain management. Once you are able to swallow liquids, you may transition to a liquid pain medication. If your pain is 5 or less on a scale of 1 to 10, you may be able to use Tylenol for pain relief. You should manage your pain well enough to be comfortable getting up and moving around and taking deep breaths. You will be discharged from the hospital with a liquid pain medication. If you have any concerns about pain management, please speak to the anesthesiologist or bariatric surgery team. When to call the doctor. Your discharge instructions will include a list of reasons to call the doctor. You are encouraged to call about any concerning symptoms. After surgery, you will have follow-up appointments. Follow-up appointments will be scheduled every 3 months for the first year and then once a year after that or as needed. It is important to attend or follow up visits. If you miss a visit, please call to reschedule. After surgery, you will have a post-op nutrition plan. Follow up with the dietitian is also a very important issue to progress with weight loss. Please follow the post-operative nutrition recommendations and attend follow-up appointments with the dietitian. Medication adjustments. It is common for medications to be adjusted following bariatric surgery. This is particularly true for medications for high blood pressure or diabetes. Patients are encouraged to monitor blood pressure and blood sugar and attend follow-up visits for medication dose adjustments. Please partner with your healthcare provider when decreasing or discontinuing medications. Exercise and lifting. You will be up and walking the day of surgery. Lifting, however, will be limited until the surgeon releases you to do so. Weight loss after surgery is the fastest in the first 6 months and will slow after that. Total weight loss happens over 2 years. Carefully follow the post-op diet, fluid intake, and exercise regimen. Medications after surgeries. Medications that you will need to avoid after surgery and for the rest of your life include the following. Pain medication known as NSAIDs, COX-2 inhibitors, or aspirin. For example, ibuprofen, Motrin, Advil, naproxen, Aleve, naproxen, Celebrex, indomethacin. This is not an all-inclusive list. Why you should not take them? It may increase the risk of stomach ulcers. Your healthcare provider, however, may recommend a low-dose aspirin to help manage certain heart conditions. You should avoid extended release medications named ER, CD, CR, SR, XR, and XL. For example, Cardizem, CD. You should not take them as they may not be broken down or work as expected. Your healthcare provider may change your extended release medications to a different form. Talk with your pharmacist if you have questions. You should avoid enteric-coated medications. They may not be broken down or work as expected. You should also avoid oral bisphosphonates. For example, Fosamax, Actonel, and Boniva. You should not take them as they may increase the risk of stomach ulcers. These are medications that are often used for conditions such as osteoporosis and osteopenia. Medications that you'll want to avoid for 12 weeks. Large-sized capsules and tablets. Ask your healthcare provider or pharmacist if you can chew the tablets, cut the tablets in half or in pieces and take with a small amount of liquid. Open the capsules and mix with a small amount of food, or get the medication in liquid form. Medications you can use to control pain include acetaminophen, which is the preferred over-the-counter pain medication option. Take Tylenol 500 milligram chewable tablets or acetaminophen 500 milligram tablets cut in half or in pieces with a small amount of liquid. Do not take more than 3,000 milligrams of acetaminophen a day. Read labels carefully, as some prescription medication also contains acetaminophen. Contact your health provider if stronger medication is needed for pain. Let's review vitamin and mineral supplements after bariatric surgery. Bariatric surgery changes your digestion and limits the amount of nutrients your body gets even when following a healthy diet. You will need to take vitamin and mineral supplements every day for the rest of your life. Begin taking your supplements as directed by your healthcare team. Mayo Clinic does not endorse specific brands or companies and recommend that you select your own personal preference. What you will need: You will need a complete multivitamin with iron daily. Calcium, you'll need about 1,200 to 1,500 milligrams per day from diet and or supplements. This should be taken divided into 2 to 3 doses per day. Vitamin D3 or cholecalciferol, 75 micrograms or 3,000 international units per day. Vitamin B12 or cyanocobalamin, 500 micrograms orally per day or a prescribed monthly injection. Step 1, choose a complete multivitamin with an iron supplement. It needs to be chewable for the first several weeks after surgery. However, it is important that you do not take gummy multivitamins or use vitamin skin patches as they lack needed minerals. Here are some recommended good and fair options for a multivitamin. Choose a calcium supplement. You will need to count calcium from all sources, multivitamin, foods, and beverages, including protein shakes. Choose either calcium citrate or calcium carbonate supplement. Calcium citrate is preferred. Calcium citrate options include Bariatric Advantage, calcium citrate chewy bites, berry melt calcium citrate, which is a dissolving tablet, Nature's Way calcium and vitamin D3 liquid, or Bariatric Fusion calcium citrate chewable tablet. Some calcium carbonate options include Caltrate plus mineral chewables, Viactive calcium soft chews, or Tums extra strength tablets. Step 3, choose a vitamin D3 supplement if your multivitamin and calcium supplement combined do not provide a total of 75 micrograms or 3,000 international units of vitamin D per day. Options include nature-made vitamin D3 soft gels and Infamil D by Sol vitamin D drops. Step 4, choose a vitamin B12 supplement if your multivitamin does not provide enough vitamin B12 or if your healthcare provider recommends additional vitamin B12. You can take this supplement by putting it under your tongue sublingually or having it injected. Discuss with your healthcare team which option is best for you. Some options include Nature's Bounty Quick Dissolve B12 tablet, Spring Valley sublingual vitamin B12, or a monthly injection. This is by prescription only. You can either give yourself the injection or you may choose to have your local healthcare provider give it to you. Step 5, keeping track is important. Create a supplement schedule. Some examples are listed below. For best tolerance, take your multivitamin with food and not on an empty stomach. Do not take calcium supplements within 2 hours of taking other medications, including other supplements, except for vitamin D. Calcium citrate may be taken with or without food. Calcium carbonate should be taken with food. Remember to take calcium in divided doses with no more than 650 milligrams at a time. After surgery follow-up. Most people leave the hospital the day after surgery. You will see the surgeon 1 to 2 weeks after surgery, and sometimes 1 month after that as well. You will meet with your endocrinology provider and complete lab work at 3, 6, 9, and 12 months after surgery. You will see the dietitian at 3 to 4 weeks, 3, 6, and 12 months after surgery. Long-term follow-up. Healthy habits are important, and awareness is key. Seek help early if you are regaining weight. There are support groups that are available. Follow up with your dietitian and your psychologist if needed. Avoiding weight regain after bariatric surgery. Weight regain usually begins between the first and second year after surgery. In the first year, weight loss is influenced by physical discomfort, decreased hunger sensations, and regular follow-up appointments. Let's test your knowledge. Which of the following can lead to weight regain after surgery? Continuing to track your diet, decreasing to 1 to 2 meals per day, limiting snacks to 0 to 2 per day, or exercise. The correct answer is 2, decreasing to 1 to 2 meals per day. Let's review predictors of weight regain. Increased food cravings, lack of monitoring food intake, grazing on smaller amounts of food throughout the day. This is a handful of nuts, or walking past the closet and grabbing a few chips. Drinking beverages with meals, especially caloric containing beverages. Returning to old habits is also a predictor of weight regain. Things like skipping meals, drinking alcohol, eating larger portions, and eating more of the added sugar or high-fat foods. Not attending follow-up appointments is a large predictor of weight regain. Those who do not attend follow-up appointments are 4.5 times more likely to regain weight. Binge or late night eating. You may feel a loss of control with foods. Seek help from a personal counselor if this is true. Unrealistic expectations. For example, saying things like weight loss surgery will solve all my problems. Some weight regain is expected. So what can you control? Choices in behavior, foods, and activity. What you can't control include age, genetics, medications, and medical history. Exercise remains important lifelong. Physical activity and exercise will decrease abdominal fat, known as visceral fat, and help maintain muscle mass. Exercise helps to regulate hormones, and muscle mass is metabolically active. Let's discuss the anatomy of weight regain. The surgical pouch becomes more tolerant of foods. The pouch can be overfilled by eating a large amount of food at a meal. For example, if you only eat twice per day, you may be eating a larger portion at each of those 2 meals. Carbonated drinks can also overfill the pouch by increasing pressure. Food consistency also plays a role. Smooth and slippery foods and fluids will move through quicker. This is not a good plan. The goal is to slow down gastric motility for prolonged satiety or fullness. Protein and fiber are slow to digest and better choices. Slider foods include ice cream, peanut butter and nut butters, oils, gravy, mayonnaise, and chocolate. Slider beverages include alcohol, juice, soda, sweet tea, excessive milk, protein shakes, Gatorade, energy drinks, coffee drinks, and beverages with calories. All calories count. Your goals 1.5 years and on after surgery include 1,000 to 1,200 calories per day, 60 to 80 grams of protein per day, 64 ounces or more per day of fluid, and your goal amount of food at meals is about 1 to 1.5 cups. Choose low-fat protein, 3 ounces at meals. Things such as turkey, chicken, or lean fishes. Avoid added sugar and high-fat foods. Avoid frequent snacking. And avoid refined carbohydrates. Things such as white bread, white rice, and pasta. Some tips include to stay tuned in to your own hunger and fullness cues. Eat 3 meals and between 0 or 2 snacks a day. Manage your own triggers to overeat and cravings for unhealthy food choices. Return to structured and consistent eating pattern. Restart tracking on a program or a phone app. Things like MyFitnessPal. Remember your online goals, though. These online calorie recommendations are not accurate for bariatric surgery patients. In review, some weight gain is expected. Take steps to prevent the excessive regain of weight. Follow up with your dietitian for more personalized recommendations, and remember, we are here for you. Also, attend the Mayo Clinic support group meetings. Feel free to contact us through the portal if you have any questions. And thanks for joining us.